3632 services for students throughout the state, going out on a formula basis, similar to that you see in special education funding in the existing AB 602 formula. So mental health services that are currently funded under the mandate formula would now be funded and provided by schools, funded and under the responsibility of schools with resources funded under the AB 602 formula with a component for extraordinary costs, very similar to what you see in the existing special education program that we've operated under since 1997. That's the core components of the proposal in terms of funding and the transfer. So we're going from realignment to a funding mechanism similar, in fact, identical nearly to what we have in special education today. It is intended to provide an adequate resource base for those services. We've tried to carefully construct a resource base that will ensure enough for those services to continue and allow schools to continue to partner with the mental health professionals that have been providing those services to this very day, so that if someone is in a school district now and they're providing services to students, they could continue those partnerships. They have the resourcing to do that. But the program and financial responsibility for that level of service, and this is a key difference, would shift from the mental health arena to the schools. That is a key difference. We think that schools would be able to do this. Schools are already, as you all know, integrally involved in the IEP process, the individual education plan process. So this component would be moved in under the schools as well. It would be a transition, and the administration recognizes that. This year, as you also know, with the suspension of the mandate, has been a difficult transitional year because it's a suspended year, and we recognize that as well. This proposal intends to provide adequate resourcing for a transition so that there is enough for the schools who are already providing IEP support to take this component in as well into a process that they're already a part of. Again, they could partnership with counties, they could partnership with other providers, the schools could, and it would allow them the accountability also in terms of ensuring that these mental health services are part of that educational outcome process. So it allows that component to be incorporated in the process as well. We're not proposing additional statutes in terms of state statutes or state regulations. In fact, we are indeed proposing the repeal of the AB 3632 mandate and the state statutes associated with that, and the state regulations associated with that. And we are proposing instead that federal laws and federal regs be followed. So those are the core tenets of our proposal. We believe that it allows schools the accountability, the flexibility, and the resources to provide these services. It allows them the opportunity to continue to partnership with the mental health professionals that they will need to continue to provide these services to students. And we believe it's a sound proposal to allow kids to succeed in the classroom. Those are my introductory comments. We'll be happy to answer any questions you may have.
Thank you. I appreciate that. I don't know if we have questions from the committee, and we are convening here as a joint committee. I want to welcome our Human Service Committee members, and particularly Chairwoman Ms. Mitchell. just had our first presentation from the Department of Finance on the governor's proposal around AB 3632. Some of the components there of the realignment to school districts, and then the issue of actually repealing of a mandate around and other statute around AB 3632. I think we'll go on and continue to hear some of the other comments from our panel. LAO's office, thank you for being here.
Thank you. Rachel Ehlers, LAO. We do have a handout on this. The first several pages are just background that I think we're all pretty familiar with at this point, but we provided it in case you need a refresher. But I won't walk through it right now unless anybody has any specific questions. I will just highlight on page 2, you can see the chart. The current funding scheme for this program is incredibly complex. It comes from several different sources, including the mandate reimbursement process. It's taken us a year and a half even to be able to put this chart together and try and get a handle on what all the pieces are and how much they are. So I think everyone would agree that the current system is very complex and there are multiple players involved. Page 3 just highlights some of the chaos of the current year in the wake of Governor Schwarzenegger's veto and the awkward shift of responsibilities to schools in the middle of the year. Still being litigated. We covered this in pretty significant detail in February when we had our joint committee on what's going on in the current year. And as a result, as part of the March budget package, the legislature did put an additional $80 million in for schools. That kind of happened on the ed side of the budget. So just to be sure the Health and Human Services committee members are aware that the March budget package did include additional one-time funds for schools to try and help accommodate some of the issues in the current year. Page 4 I won't really go over because it's what Mr. Bell just presented on the governor's proposal. I will just highlight in the second box the 3 bullets show the different sources of funding that make up the governor's proposal for the budget year, increasing Proposition 98 by $222 million, which would also be part of a, quote, rebenching of Proposition 98, a permanent increase to the minimum funding requirement for schools. Some federal special education funding that would continue as it has in recent years, although now it would stay with schools rather than passing into county mental health. And then it does maintain $99 million in Proposition 63 funds. These are mental health funds. These can only go to counties. So this is a somewhat, in our opinion, awkward piece of the governor's proposal in that now responsibility is shifting to schools. Most of the funding is shifting to schools. This one piece would stay with counties. So as we understand it, the only way that school districts could actually access these funds is if they chose to contract with county mental health to be their providers. But that makes up the full $390 million that was referenced. We think this estimate of current costs is not totally unreasonable. We've seen their methodology, and it's a reasonable estimate at getting at what the program currently costs. It's pretty generous. It does provide a COLA for 2011-12. No other program in education is getting a COLA for 2011-12. I'm not sure if there are any other programs in any part of the budget that are getting COLAs, but this program was provided a COLA to get to this estimate. So now turning to page 5, our office's assessment of the proposal. We would recommend the legislature adopt this policy proposal to shift the responsibility to schools. We've made this recommendation for several years. We think it makes sense on both a fiscal basis and a policy basis to align the responsibility with the student's education and educational outcomes and educational goals. That's the intent of the federal program. Really refocus that link between the educators and the outcomes. This is supposed to be a program that helps students access their education. We also think there's greater accountability on the school side, both for how the funds are getting spent, but also for what student outcomes are. Our whole student accountability system is really housed at the school level. And then from a fiscal perspective, we think this simplifies it and really encourages cost-effective provision of services. So on the policy side, we think this makes sense. We think you can look at the funding side and make sure that the governor's proposal makes sense. As I mentioned, the Prop 63 piece is a little unclear to us how exactly that would work. And the whole issue, which we discussed a little bit this morning, of should Proposition 98 be rebenched and what does that mean and by how much. But in general, on a policy basis, we think this makes a lot of sense for students. The final page of the handout addresses some of the implementation issues. Were you to approve the governor's proposal to shift these responsibilities, there are a lot of decision points still before you. How much funding should be provided, and what should the sources of that funding be? How would you allocate that funding to schools? Would you do it on just a per pupil basis, which is how our special ed formula works right now, or would you want to do it based on current mental health caseload that they have right now? Do we want to maintain state requirements on mental health services, or just, as the administration is proposing, repeal all state requirements and default to the federal mandate? Do we want to require that districts have to use these funds only for mental health services, or should it be part of a larger special education pot that districts can use to meet whatever special education needs that they have? We don't currently, within our special education funding formula, have carve-outs for particular services. We give a certain amount of funding to districts for their special ed needs, and they direct them as they have their local needs. And then there undoubtedly will be transitional issues with a shift like this. We believe the shift has already begun happening through the current year, but there will continue to be transitional issues, so there may be ways the legislature wants to help with that, additional oversight, funding, accountability. And then I think this is an issue you'll hear about with your subsequent panel. Currently, county mental health can draw down quite a bit of Medi-Cal funding, and does, to support these students. School districts don't have the same ability to draw down that Medi-Cal funding. So I know staff is spending a lot of time right now looking into, are there ways that we can make sure that schools can begin to access that funding as well, so that they have all of the resources available to them that counties currently do. Thank you.
Thank you. Ms. Gable.
Erin Gable on behalf of State Superintendent of Public Instruction, Tom Torlakson. And as I know we have discussed in previous hearings, the crisis that had been created by the previous governor's line item veto of the AB 3632 funding can by no means be overstated. The crisis at the local level has been continuing. However, it has been alleviated to a certain amount, and so we want to be very, very thankful for the $80 million that the legislature appropriated for mental health services for students in that confusion to make sure that children weren't falling through the cracks. And so here we are today focusing on the long-term issues regarding the design of these services and how we can establish a long-term vision about how we move these services forward. And the administration has presented a proposal that is radical in nature, in that it really changes the face of the responsibilities of these services and the accountability structure that would be in place for overseeing these services. We want to recognize that the funding of the program through the mandate process has created an incredible amount of uncertainty at the local level, both in terms of fiscal as well as programmatic accountability, as the LAO has mentioned, that the funding of the services through county mental health departments has diluted responsibility as it means for children's outcomes and for actual mental health outcomes and education outcomes. Accordingly, we're not opposed to the proposal at the Department of Education, and we've actually put a great deal of thought and effort into thinking about how systematically this kind of a proposal could be implemented and how it could work, particularly in such a short transition time frame. We're very pleased that the governor's May revision makes this effort to fully fund these services and to actually appropriate a permanent funding source so that the chaos that's been happening at the local level can stop. The Department of Education would urge the legislature to consider the following additional issues if you are going to determine that a restructuring of this program is advantageous at this time. Number one would be collaboration. Since the passage of AB 3632, county mental health has played a vital role in the identification of mental health needs for our students. The department believes that it is vitally important for mental health professionals to continue to be have an active part in the identification of these needs for our special education students, and that any program changes that happen need to involve the appropriate professionals from both education and mental health arenas. Accountability. Whatever the program looks like, we need to ensure that appropriate services are being provided and that they're being provided by the correct and appropriate professionals. We need to ensure that the services are having the intended results and that the funds are being spent appropriately. System capacity. If school districts are being required to assume additional responsibilities, for example, finding out-of-state placements for very high-needs students, they must be given time and the resources to be able to develop the local capacity in order to make these very important decisions and placements possible. And then finally, transition time. Regardless of the outcome, any programmatic changes in special education, especially placement changes, require IEP meetings for all affected students. Changes of this magnitude cannot happen overnight, and the field needs adequate time in order to implement any of the decisions that are made by the legislature. The department is in the process of developing a set of specific recommendations regarding the implementation of the governor's proposal, and we have a few preliminary thoughts that we'd like to share with the committee at this time, just briefly. First, we would suggest that we have some suggestions that we'd like to work with the Department of Finance on regarding the funding allocations. I won't go into too much detail about that, but we look forward to working with them if this is an area you'd like to pursue. We want to make sure that the funding formula does not create any inappropriate funding incentives. Second, the state needs to ensure that services continue to be provided with minimum disruption to the students. We would recommend that county mental health departments be able to draw down these Prop 63 funds only if they are going to continue to provide the mental health services to the students in conjunction with the IEPs that are currently in place and with whatever IEPs are determined moving forward, and that they have an MOU or Memorandum of Understanding with the SELPA moving forward. We would also recommend that for the first year that Prop 98 funding in this way that's been designated be restricted for these mental health services only. Third, we believe that there needs to be a review of our accountability systems at a state level, mainly within the Department of Education, to ensure that the conditions that resulted in the passage of AB 3632 do not reappear, so to make sure that our accountability systems are in place to serve as a prevention against some of those problems. Additionally, a great deal of work needs to be done at the local level to develop a school district infrastructure to appropriately serve our children. We do have a proposal that we have prepared to put forward to the committee about what would need to happen at the state level in order to develop that infrastructure and to help the locals in developing capacity, and are happy at any time to discuss that further. Just the basics of our proposal for this transition year that might be happening in 2011-2012 would require the convening of a working group of professional and program experts in both the mental health and education fields around the provision of adequate and appropriate services for these students. We would want to have this working group address the following matters: a clear delineation of the scope of mental health services that are needed in order to meet educationally related needs, the identification of best practices and exemplary and effective models for service delivery, the identification of options for controlling costs and accessing other local, state, and federal funds, as the LAO mentioned, Medi-Cal being one of the great concerns about how these funds will continue to be drawn down to meet students' needs. Improving accountability for effective services and positive student outcomes. We believe that there needs to be a designed tracking and reporting system for developing additional requirements for ongoing monitoring of these mental health services, which would be a new oversight at the state level. And then finally, identification of responsibilities at the various state and local agencies that would be involved in tracking these services to make sure that all of the partners are operating as intended by the legislature. We believe that a working group could be established to provide in a very quick timeline the technical assistance and training that would be necessary for these school districts. But we do not want to understate the importance of vigorous transition support if school districts are going to be asked to make this very large transition. We want to thank the administration for their very thoughtful proposal, for the identification of ongoing upfront funding for this, and look forward to having a conversation with the legislature about how to move forward from here.
Thank you very much. I'm impressed with the detail that you've provided in terms of what needs to happen as we consider the best service delivery model for our students. And actually what you've described there in terms of the working group and what might come out of the working group, to me sounds like something that could that we can look at this entire issue as an opportunity to really see some dramatic improvements around the service delivery. I'm not in any way taking away from what counties have been providing, but in terms of this integration and improved accountability and this identifying clearly the scope of the services, those all sound to me like very good ideas to be pursuing. Before we let this panel go, and I believe that, do we have some mental health, Department of Mental Health to speak? Do we have questions at all? Okay, Ms. Mitchell.
Thank you, Madam Chair. I guess when I listen to the department's list of ongoing kind of issues with this kind of transition, at this stage in the game, it gives me continued cause for pause, because in that your list of questions and issues that we have to consider is longer than my own. It suggests to me that we're not in a position to take action in terms of making this transition happen now, as opposed to resolving some of these issues and continuing to perhaps institute the work group to get to a better place where we have more answers than questions in terms of what will happen to children as a part of this transition. What I would add to your list with regard to accountability, a word and issue you raised repeatedly, is really making sure that we track underrepresented communities who already have a difficult time navigating special ed systems, accessing all of these necessary services today, much less when we can make this transition and eliminate the statewide mandate. So I would be really interested in making sure that we track the participation and outcome of English language learners, low-income students, communities of color, whether they're either underrepresented or overrepresented in the new emerging program, just making sure that these at-risk communities of children continue to get the services that we all know they need and are entitled to. I would just add that lens, if you will, to your overall issues around accountability. You know, really making sure that we're not at risk of losing critical services, making sure that the mental health component and mental health professionals continue to be directly involved in this process as we move into the educational setting.
Ms. Brownlee?
Thank you. I just wanted to sort of follow up on Ms. Mitchell's comments, because I agree, and I think that, I sort of see this as two things. One is to try to get to a new system, because I think that there are definitely benefits from that. But most importantly, that I think it is the transition, and it's the transition to the kids who may be coming into the system, and it's the transition for the kids that are in the system, and how we're going to deal with that. Because we know that particularly for the students who are receiving these services now, they're our most vulnerable, and any interruption in their continuity of service can really set them back very, very significantly. And so it just seems to me that we can agree to move forward in the long run, but what is that detailed plan going to be with regards to transition, that our kids continue to improve and meet the IEP goals that were set out for them, and not have huge setbacks from this transition, because it's fiscally right, or policy-wise, it seems like school districts should have, that accountability and so forth. And so that's, for me, we just have to really nail down a level of specificity for transition before we could move ahead.
Thank you. And I have two questions, and I don't know if they are best answered in this panel or the next panel, but that came up with the reports you gave us. And one was, what are the key differences between the federal requirements and the state requirements, as that's part of the proposal would be defaulting to the federal. And then also the issue of the Medi-Cal funding, how does private insurance coverage for medical necessary versus educational necessary services, and how does that get unwound as well? So I don't know if those are questions you would like to address, and then or the next panel.
Sure. And here with me today, we have Fred Balcom, who's the director of our Special Education Division, and can answer a number of your questions. And just to start to get to your question around the difference between the federal and the state mandate, the state mandate has incredible specificity, whereas the federal mandate is incredibly broad. And so while we don't have a drawdown list that can show apple-to-apple change or difference between the state and federal mandate, there definitely is a concern on behalf of the department, and I would believe at the local level as well, that there could be confusion at the local level when it comes time for reinterpreting the broadness of the federal mandate vis-a-vis the specificity that has been in place around the state mandate for a number of different
And I think that goes to the question of the transition time, is that instead of maybe just checking out, the state statutes that have built, that have come into play around this issue, part of the transition may be that clarification of what really in California do we require. Fred, thank you for answering my questions.
Thank you. Fred Balcom, Special Ed Director for the Department of Education. Some fundamental differences exist between the education-related needs and other needs of students that may be part of the mental health component. Educationally related tends to focus more on the student. They're in a relationship with the school and the community, whereas in some cases the mental health component goes far beyond that and deals with the family needs as well as the family and community interaction. Students have been placed with under AB 3632 under very specific requirements. During this transition period, there is a certain level of expectation for families and communities that services would continue as it changes to a more vague federal definition. And this transition time is really critical, as well as an incredibly heightened sense of work and energy put into making these definitions more clear for families, both in terms of for those in the system now as well as for those entering the system. The last thing we would want to have is a breakdown where we create a dual system of mental health supports. In terms of the Medi-Cal billing piece, this is also tied up with the two definitions. We are working with various stakeholders to try to identify ways in which the students who would ordinarily be identified as eligible for Medi-Cal would continue to receive those. But again, there are students who would not be eligible for Medi-Cal based on their income levels, but there may be other mechanisms where we identify their eligibility, because once again, we would be identifying those who might get services through, for instance, county mental health because they're Medi-Cal eligible, and those who wouldn't because they're not. We don't want to have a situation like that evolve. Again, it comes back to, as Aaron was mentioning, we need intense work in this transition time. If you could envision this, to take this into the next year is like building the airplane while we're in the air. Realistically, this is a very difficult transition. Up until this very recently, we were thinking this was going to be a mental health responsibility. We are in support of the proposal. We think education has all the capability of doing what's necessary, but we can't do it instantaneously. And so the transition is critical. The funding, we believe, is on the right track. And what we would like to do is to convene the work group, as Aaron Gable mentioned, so that we can begin working on this right away, because time is critical.
Thank you. Mr. Bell?
Thank you. If I could just make a quick comment in acknowledging that transition is important because already the mandate is suspended.
Right.
And so given that, we're going to have to make the transition from where it already is, which is a very difficult place. So we acknowledge what Fred's describing. However, moving forward, we think that the best place for it to be is in education, and time is of the essence. And so while we recognize that there's a need to do this carefully, we also think that time is of the essence, and thus a need to act more in a expeditious manner perhaps might be the approach to take versus a prolonged approach, given that we've already had a year of time where we've been in a suspended mandate. Now we want to move into a time where we can get the mandated services being provided in a manner where education professionals know we're already in the IEP process. We're going to take the mental health services and bring them in as well. Let's move as expeditiously as possible and bring these mental health services into the fold as well versus a drawn-out approach. Because I guess what I would like to express is that we would like to bring these services into the process as reasonably expeditiously as possible. So I'm trying to make sure I express that position to you, that we wouldn't want to make this sound like something that would be a long and drawn-out process, because we would want that certainty to be there for districts that, yes, the resources are here, we're going to provide you with a timely process that's going to give you certainty. This is the process we're bringing towards for you.
And in terms of the, what would be your opinion of having a in MOU or just a requirement that school districts for this period of transition of 1 year continue to work with counties, or have an MOU for counties to continue to provide the service in this 1 year where everything would be worked out?
Well, we've got one of the resources that's part of the process, the three funding mechanisms, the $98.6 million, as had been pointed out in the LAO's presentation. Actually, those funds are indeed drawn down for mental health professionals from the counties, and they will only be available for those districts to draw down from mental health professionals within the county. I guess what I'm saying is they would have to work with counties.
I can see a dynamic where we could have a two-headed monster created, between the counties and public education. And I guess to make the transition happen as smoothly as possible, I think it would be important to identify kind of where it would reside, where this, services, the decisions would be residing in the period of transition. And I think the hesitancy is to have all of that shift over to education when the counties have been doing it. Maybe we need to let the counties continue in that role and be the transitioning agents along with the schools.
And that would not be our position at all. We would definitely support having it shift over to the schools and have the schools have that certainty that they could continue those partnerships. Indeed, what they've already started as a result of the suspended mandate.
Well, some of them, not all of them. A lot of counties have continued providing service. Yeah.
Yeah, I understood, understandably, but our position would be to shift it to the schools with that certainty and the level of resources to do so, and that would be our position.
Fred?
Thank you, Madam Chair. We believe that the money that flows through to county mental health, the $98 million already, needs to be targeted in a way that it is used solely for the services as they have existed in the past until such time as that money is exhausted. And in the more detailed, thoughtful plan that we're presenting later on, we have some suggestions around that, so that we do transition, as you suggest, from solely a mental health controlled system to an educational system. There needs to be a blending and a working through the process as we go forward. We also looked at AB 3632, and while we agree that most of it could be eliminated, there are pieces of it that deal with more than just mental health. We needed to be more exact in the pieces that might be repealed, as well as the regulations surrounding that, because it also involves such things as California Children's Services and health-related services to students, not just mental health.
Thank you very much. All right, I'm going to turn this over to Ms. Mitchell to take roll, and I think we'll do a transition in our panel at this time and have our mental health team come up.
Well, unfortunately, I lost my sub-1 quorum.
Oh.
We had a full committee for a moment, and now we don't. So we'll just go ahead with the transition, and if we get a third member, we'll do roll call then. Thank you.
All right, but we do welcome Assemblymember Chesborough also for being here. Thank you for joining us.
Madam Chair, if I might, just as a point of clarification and just to be clear, the only portions of the 3632 statutes that we were addressing were the parts associated with the mandate. So when we're talking
in terms of a repeal.
Yes, just to be clear, we're addressing the portions of the statutes that are the portions associated with the mandate. And just to be clear on that last statement. So
okay.
If it's associated with the mandate, AB 3632, those are the portions that we are looking to repeal. So as a point of clarification in our
It would
statement.
probably be helpful for us to understand exactly
Okay.
what that is.
We'll
if we can
provide that.
see that, we would like to be able to
Okay.
read that.
And the department would be happy to help enumerate where there might be other impacts within the code for other services other than the mental health services outlined.
Very important that we understand that before we would weigh in on that issue. Ms. Mitchell.
And Madam Chair, I just wanted to clarify before Finance leaves the table, just to make sure that I'm clear, in that we are having this conversation in the context of May revised budget hearings. There's no scored savings in general fund for 11-12 with this transition. Current fiscal year, there's no general fund impact, I guess I should say, through the elimination.
Ms. Mitchell, I can answer
Okay,
that.
all right.
Rachel Ehlers again from the analyst
Yes,
office.
yeah.
For the budget year, for the budget year, you're asking
Budget year,
for 11-12.
budget year.
There's actually a cost. They're increasing cost by $222 million. There's no savings. It's an
Okay.
increase in expenditures to recognize that.
Got it. All right.
Teresa Calvert with Department of Finance. We would note there is a small amount of administration savings in the Department of Social Services budget for approximately $1.4 million. So it wasn't a solution, but it was savings realized as a function of the SED
long-term
local
transition.
assistance moving over. So there's $68 million total coming out of Department of Social Services budget, $66 million of which is being transferred to the schools, and $1.4 million of which is savings.
Okay, so I asked the question in the context of the chair's question around, a year out in terms of the planning process. I just wanted to know what fiscal impact it would have on budget year.
And I think one thing that hasn't been mentioned too as part of the administration's proposal in budget year plus one, the Proposition 63 funds are being proposed to be used for 1 year, that $99 million. In budget year plus one, the administration is proposing to shift an additional $100 million to schools, increase the Proposition 98 by an additional $100 million. So they really are, I think, trying to be upfront about this is how much the program costs. We're giving schools that funding for that.
And also on the same point, the Department of Education has projected and shared with committee staff, and I also would like to share with you, in addition to the transition costs, we would also see ongoing accountability costs that would be covered with federal funds, but it would be a growing accountability workload that would need to be covered with increasing federal funds over the years in order to accommodate this. So that's something we would want to work with the committee on.
Thank you very much. And I believe we have members from the Mental Health Department. Is that correct? Department of Mental Health? A panel of stakeholders. Oh, okay. Panel of stakeholders. Thank you very much for joining us. Let's begin. We have limited time, so in the interest of letting everyone have an opportunity to at least comment, we'd ask you to keep your comments brief and to the point. Thank you very much. Let's begin.
Carol Schroeder with the California Alliance of Child and Family Services.
Okay.
This is a really clever, very superb budget proposal, and I don't say that, I don't mean to sound pejorative about that, because we actually oppose it. That has something for every interest group with skin in the game. It caps state costs for the year and in the future. It moves those costs and revenue from the state general fund side of the ledger over to the Prop 98 side, so you solve a problem. It relieves county mental health agencies of underfunding of a mandate, solve that problem. It relieves county welfare agencies of responsibility for paying for residential services, but it lets them keep the money so they can use it for other costs for which they're not being reimbursed or under-reimbursed, solves that problem. And shifts in the costs and revenue for those services to the schools and virtually fully funds it with a COLA, which raises, of course, begs the question, well, why not do it for the current system? Unfortunately, what this ignores or doesn't speak to are the kids and families. And so this is like government talking to government. The analysis doesn't mention that AB 36, none of the analyses mention that AB 3632 was instituted as a result of a lawsuit. Schools had full responsibility for these services and support until Christopher T., or actually Christopher T.'s parents, sued the San Francisco Unified School District. And Willie Brown came up with something that was something of a Solomonic decision. And the plan that he came up with was to align responsibility with expertise. So mental health, schools, education, residential services, child welfare services. They're the ones who kind of know about those things. It may be a little clumsy, but it's worked for 25 years. And it's worked because of that pairing of expertise and responsibility. The parents of the kids and families are not complaining about this program. The concerns that have been raised are problems that can be solved. They can be solved in the context of the current system. We don't have to do what we're proposing here. This is a budget proposal, but it has huge policy ramifications. This is not a policy proposal that has some budgetary ramifications. With regard simply to the residential services, where about 2,000 of the 20,000 kids served, will the current CCL licensing standards apply? If not, what standards will apply in those situations in terms of the quality of programs and facilities? What about the staffing requirements under the current system that currently pays for these services, the staffing requirements under the RCL system? Will they apply, or will there be some other ones? How about the rates? Will rates be set in each individual CELPA, each individual school district, or will that be set by the current RCL system, or whatever succeeds that? Who will set the rates? How are they going to be set? Will kids placed by education be able to be in the same programs and facilities as kids placed to the child welfare system who have the same kind of needs and require the same kind of services? What about the very large percentage of AB 3632 students currently placed, say, in Utah or out of state? Will they be brought back to California for their services? If there are problems with the 3632 program, and there clearly are some problems, this is the solution. It's like a physician prescribing decapitation for a patient with a headache. If there are problems with the 3632 system, let's solve it. Let's not kill the patient in order to save them. If we can fully fund services under education, let's fully fund them under the current system. We've had 25 years to demonstrate this works. We don't need to mitigate the potential harm to students that may occur as a result of this huge programmatic change if we don't make the change.
Thank you very much. Next speaker.
Rusty Selix for the California Council of Community and Mental Health Agencies. We are nonprofit agencies who provide these services, but what I haven't heard a single person mention is we also provide the same services to the same children who are in Medi-Cal. In the LAO's report, there's one sentence saying, some kids are in Medi-Cal, those are funded through the counties outside of this. The fact is that's at least half the kids. So rather than realigning a program from counties to schools, you're going to take half of it and switch it to schools. The providers who serve both sets of kids provide identical services for identical outcomes. The idea that somehow the educational outcomes and the medical outcomes are different is pure nonsense. And why is that? Because in mental health with a child, the main goal is getting the child's educational performance to age-appropriate level. That's the indicator that the mental health care has accomplished its purposes. So it's the same objective. As was previously mentioned, under the old system, kids were being served. The payment problems existed. In the current year, for those schools that have not contracted this through counties and have tried to manage the costs, we're seeing significant changes. Fewer kids being identified as needing services, even though there's no reason to believe the need has gone down. In fact, the need has tended to go up. We've also seen efforts to prematurely end an expensive placement and bring a child back because of fiscal reasons, and attached to my written paper, which was provided to you, is an example of these children weren't ready, it didn't work, and now they're going to have to go back again. It's not working. The bottom line is that the program, as the previous speaker just mentioned, was working fine. You're not shifting a program, you're shifting half of a program. The concerns about the management and oversight are solved by the governor's January budget proposal. If you realign the program to counties and provide the counties with dedicated funding for this, it can work. Now, the problem with the January proposal, it was nowhere near the amount of money you're proposing to commit in general fund dollars to the program. Nowhere near this amount of funding. If you take this amount of money and index it with like a Prop 98 level growth as you're proposing to do in rebenching 98 and give it to counties, you solve all these problems. The fact is the counties, with realigned responsibility, will have the ability to manage the program much better because they're managing all of it. The Medi-Cal, which they will have even under this program, they will still be responsible for the Medi-Cal. We don't understand why it is so easy for the administration to come up with the money to do this. It's general fund dollars. It's not $98 because you're rebenching it, to do this when transferring it to schools when they can't come up with the dollars to provide it to counties. That makes no sense to us. But if for some reason the political magic is such that you can only come up with the money to give it to the schools, then we join the Department of Education and add to that number of controls. The most important to us is that these dollars must be only eligible to be used for this program. Otherwise, you create a powerful disincentive to not identify children. And the growth, the Prop 98 adjustments each year, and this additional pot must grow with it and be dedicated to that. Clearly, having no statute isn't going to be acceptable. Also, we think it's required that you contract with the counties to provide the continuity and the providers the counties contract with to provide the continuity and the merging so that whether you're Medi-Cal or not and kids go in and out of Medi-Cal, if you keep it separate, you're going to get different services based on whether the family is in or out of Medi-Cal, and lots of families go in and out all the time, and that makes no sense. And finally, from all of this, is that we don't think it's a transition issue where you want to do that for a temporary period. We see no benefit to letting schools do this on their own. Again, given that the Medi-Cal kids are going to be served by counties anyway, require it there. Require it all through that. If there are concerns of the schools that they can't manage the county costs, there's a complaining now, let's measure them. Let's require the counties to document their costs, and let's see how they vary throughout the state. And if we find some outliers are too high, we can deal with that. So as the previous speaker indicated, all the problems can be solved by keeping this with the counties. And transferring it to schools is an enormous policy shift. I can't imagine trying to do it in the short amount of time you have to do the budget and doing it well. And if for whatever reason you find that you have to do it, please, we need all of these controls. You're taking enormous risks, and I'll guarantee that if you do it the way the administration proposed, thousands of very vulnerable children are going to be harmed.
Thank you. Next speaker.
Thank you. Good morning. My name is Shelton Yip, and I'm here on behalf of the State SELP organization, as well as the Coalition for Adequate Funding for Special Education, representing the 681,000 students in the state with disabilities. You're well aware of the chaos that has been created by the blue lining of the funds, and so I will not go into that piece of it. The current language provided in the May revise offers SELPAs and districts some answers, but as always, it's created more questions, as the previous panel and this and my colleagues at the table here have stated. But as a state organization, we are willing to do what is necessary to ensure students with disabilities receive the services that they are required to be provided under the IDEA. We as a state organization are evaluating the many implementation issues associated with this proposal, but firmly believe that if the state chooses to shift the responsibility to provide these services to the schools, then schools should be given full latitude and authority to determine how best to provide these services. And as a state, we must ensure that the level of funding proposed will cover the increased costs, and we emphasize the need for dedicated, stable, adequate funding to meet the needs of these students now and in the future. We believe that the flexibility to allow school agencies to control their costs commensurate with the revenues they receive from the state. We also support granting school agencies the authority to become institutional or organizational Medi-Cal providers. We support putting caps on administrative fees that the school agencies can be assessed by county mental health agencies. As Member Brownlee has stated, and all of you have stated before, we support having a transition period. Especially, it is necessary to ensure that pupils currently in residential placements, often out of state, do not have negative impact on their treatment plan as we transition to a new funding model. We support an interagency relationship between SELPAs and county mental health to assure ongoing sharing of information regarding pupils and families accessing services from both agencies. And with that, I thank you for your continued support.
Thank you very much. Next speaker.
Margaret Johnson with Disability Rights California. We're the federally mandated protection and advocacy system for the state of California, and we work to advance the rights of Californians with disabilities. While we believe this is a good opportunity to examine the current system for providing services to students with mental health disabilities, we think it's important to consider the impact on children if the process moves too quickly or does not have sufficient oversight to ensure there are beneficial outcomes for the students. Without proper transition planning, we are concerned that children and youth will lose services, and many students may end up having delays in receiving services or not get services at all. And that could ultimately lead to long-term costs as students' unmet mental health needs reach a crisis level, and children and youth would require intensive higher-level interventions such as hospitalization and institutionalization. Further, pupils may drop out of school and end up on the streets or in the juvenile justice system. In fact, California currently provides special ed students to the youth and juvenile justice system at a higher rate than the national average. So without good transition planning, children and youth also may need to change mental health providers, day treatment programs, or residential programs, and wouldn't get continuity of care. For the most part, California schools simply don't have the experience or staff to provide the services that county mental health agencies have provided for 2 decades. It's unrealistic to expect that school districts can take over assessing, identifying mental health service needs and placement alternatives without some sort of transition. We're currently seeing issues with identification and referral of students for mental health services. There have been a significant dip in referral numbers in counties where there are no contracts with county mental health agencies to provide the services. During the latter part of 2010, after the previous governor's decision to suspend the mandate, and mid-February 2011, so I have some stats from that. Contra Costa County exhibited a 40% drop in referrals. Tulare County saw 0 referrals. Ventura saw a 13% drop, and Santa Clara saw 40 or 47% drop, depending on which baseline data you were looking at. So transition planning really must occur over a period of time in order to reduce the impact on children. Until transition issues are worked out, we believe the legislature should consider providing better incentives to schools to contract with county mental health agencies. And I think this goes to the point about the Prop 98 money being given to counties to continue to provide those services if the schools contract with them. Further, there have been some assertions that services children receive pursuant to AB 3632 are not educationally related, but are rather medically necessary. There's nothing in AB 3632 currently that suggests or even encourages counties to use a medically necessary standard for providing services. In fact, under Government Code Section 7576, it requires that before a child can be referred for AB 3632 services, that the mental health disability must impede the student from benefiting from her special education. So our concern is that children who are currently receiving services may have their services cut back once the school districts become responsible for services, and parents wouldn't be given the appropriate due process rights that they're entitled to under IDEA potentially. Thus, we caution against assuming that AB 3632 services go beyond what is required under IDEA, since it could lead to stopping services a student needs to benefit from their education. We read federal law to require all related services a child needs to benefit from special ed. And while it's not as specific perhaps as state law, we believe that the federal law would cover all services that a child needs in order to benefit from their special education. It's also important to consider whether this shift in responsibility will ensure that services are provided in the least restrictive environment. LRE is one of the cornerstones for IDEA, and there are no provisions for assessing whether the shift in the provision of mental health-related services is appropriate and serving children and youth in the least restrictive environment. We encourage the legislature to ensure there is oversight in order to ensure good outcomes for students, as well as ensure there is accountability and transparency in the process. And then finally, we are also concerned that the lack of MHSA, that we're concerned that MHSA funds may not be used for students, and really want to encourage that there be some process put in place to make sure that counties don't get the money unless they're going to be providing the services. And then we're also concerned about the loss of Medicaid funding, as other speakers have mentioned. Currently, only a handful of schools are currently set up to obtain Medicaid funds. LA Unified is one of those school districts, and there are a handful of others. But we just want to make sure that you consider that loss of funding that may occur if the shift occurs to the school districts too rapidly. So thank you very much for your time and consideration of this issue.
Thank you. Next speaker.
Madam Chair and members, I'm Pat Ryan, representing the California Mental Health Directors Association. I have been dealing with the difficulties of this program for the 10 years that I've been in this position, and I can tell you that it is a very complicated program, and contrary to what some of the earlier speakers said, the program has not been working particularly well for county mental health, mostly because of the funding complexities and the fact that it's a mandate and the state hasn't been paying for that. But having said that, I want to hopefully be able to answer some of the questions that you might have about Medi-Cal and some other things. First, we strongly support the governor's proposal. We think it is a viable, responsible alternative to the recent chaos and uncertainty for students, families, providers, counties, and schools that have resulted from the former governor's veto of funding to counties last year. Even before the governor's veto last year, there have been significant funding issues with this program, and a lack of appropriate reimbursement to counties for many years. The state, in fact, still owes counties hundreds of millions of dollars in reimbursable mandate claims for this program. And just since Prop 1A, which passed in 2004, my understanding is that the state owes counties approximately $260 million of unreimbursed mandate payments. As a result of the governor's unexpected veto, several months after the budget was, or the beginning of the fiscal year, counties, in fact, and school districts were required, or had no choice but to begin a transition, given lots of uncertainty. But we believe it makes sense to build on those efforts, and it's rather than characterized as a sudden transition. This transition is happening. The governor's proposal is it's a well thought out transition based on what's already happening, and it gives school districts and counties certainty that we haven't had for the last year and beyond in funding this program. It's a well-thought-out proposal because it actually provides adequate funding for schools by rebenching the Prop 98 guarantee to reflect the shift of program responsibilities. This takes into account the cost of providing the mandated mental health educational services as well as the out-of-home residential services, which are required under federal law. It does not alter a student's eligibility for Medi-Cal or a student's ability to access medically necessary mental health services through the Medi-Cal program. And just to try to clear this point up, there's nothing in this proposal which would preclude a school from contracting with the county or developing an MOU to provide the Medi-Cal match for those students that continue to meet Medi-Cal medical necessity. So it can be done through the IEP. The school would just have to provide the state's or the county's share of the match, and we continue to pull down the federal funds. The issue of somehow schools being certified to become Medi-Cal providers is much more complicated because the Medi-Cal Specialty Mental Health Program is a managed care program, and counties have the responsibility in California for managing that program. And they also have the responsibility for certifying, based on federal law, that a provider meets all of the requirements under that program for medical necessity and all the other things that go along with the federal Medi-Cal law. So a school could become and a Medi-Cal provider based on LEA rules, and I'm not real familiar with that, or they could contract with a county or a county certified and contracted Medi-Cal provider to access the Medi-Cal services within the IEP. So there's really nothing that is inhibiting or prohibiting schools from contracting with counties for this purpose. So I just want to clear that up. We believe Governor Brown's proposal to permanently shift the responsibility back to schools will lead to actually better outcomes for students because it will create a stronger connection between mental health services and students' educational outcomes. With our support of this proposal, I agree with, and we would be happy to participate on a working group to discuss issues related to the transition. We think that this is really the best alternative. It's the most common sense, rational proposal that I've seen in my many years of dealing with this program, and it really just aligns the responsibility with the entities that are ultimately responsible for the federal education entitlement program. However, we can help support the transition to schools, and let me just say about the $98 million of Prop 63 funds, we have questions about how that will work too, but we're committed to working with the schools to use that money to provide mental health services to special education students. So we assume that that money has to be accessed by contract with the schools, and that the schools will have to initiate that contract, and that counties won't be able to use that money unless they have a contract for the schools with the schools for that purpose. So, we have some questions about that too, but we think that it's definitely something that we can work on, and we can make it work. So thank you.
Thank you very much. We'll see if any of the committee members have questions. Also, if you have public comment, I'd invite you to go over to the microphone so we have an idea of how much public comment we have.
Madam Chair, while the folks are coming forward, just trying to think all this through and understand it, one question that comes to my mind is, I'm assuming that it's a voluntary relationship if a district, for the counties to contract, right? I mean, it's not something. So one of the concerns that I'm sure is going to emerge here is smaller districts that really don't have the capacity to provide the service if the county's not interested in contracting, then what do they do? So I'm just putting that out on the table.
Okay. All right. I don't see any questions from the committee up here of our panel, so thank you very much for your information. We appreciate you presenting to us. Very valuable. And we'll now move on to public comment. Please introduce yourself, and please keep your comments brief. We have a line of other folks behind you that would like an opportunity to speak as well. Thank you.
Good morning. I'm Susan Rajlal from Los Angeles County Department of Mental Health. In Los Angeles County, we have approximately 4,000 children who receive AB 3632 services. We have 81 school districts. We believe that we already have begun the transition because during the current fiscal year, we have begun the collaboration, and we have memorandums of understanding with 79 of the 81 school districts. And the memorandum of understanding is the mechanism whereby we pay for this program. So the transition has begun in LA. The transition has caused us to be more collaborative and is causing better outcomes, we believe. We think that the best, most effective public policy decision would be to have the administration of the program be with the schools. There is much that goes into this program besides mental health services. And a mental health issue is just like any other disability. If a child is deaf, for instance, we don't believe that the school district has some department outside of the school district that is responsible for those services. We believe that we're a specialty provider and that we would love to contract and continue to provide the service, but that the administration is outside the realm of a mental health professional. Thank you.
Thank you.
Good afternoon. My name is Farah McDade Ting. I'm representing the California State Association of Counties as well as the Regional Council of Rural Counties, speaking on behalf of all 58 counties in California. And we believe that Governor Brown's proposal is carefully constructed. It has adequate funding. As Ms. Ryan mentioned, it's probably the most viable, well-thought-out proposal we have seen in years. We believe that should these services transition to the schools, right now the services available, counties provide the services that are reimbursed based on the Commission on State Mandates, parameters, and guidelines. These parameters and guidelines are actually rather restrictive on the services that can be reimbursable, that counties can provide and be reimbursed for. We believe the IDEA parameters will allow schools broad flexibility in the services, such as wraparound mental health services, that they can provide to these children. We also believe, as this proposal lays out, that counties will continue to provide Medi-Cal services to eligible children and youth. And lastly, the analysis for the committee is thorough and fair, as are the concerns of all the stakeholders you've heard here today. But again, I'll point out we're in the middle, 6 months out of a suspended mandate. LA County is a great example. There are many agreements in place already. Counties and schools are working this out. The relationships have been strengthened, and we think we can build on that momentum. And lastly, again, the governor's proposal is solid, fair, and viable, and it helps provide certainty to schools, counties, providers, parents, and the children we all serve.
Thank you. We're going to pause briefly and allow Ms. Mitchell to take roll.
Please, thank you. For sub one.
Sub one.
Mitchell.
Here.
Chesbro. Here. Jeffries. Mansour. Monning.
Here. Thank you very much. All right, thank you. 1 minute, please, in your
Madam
comments.
Chair, Jolena Vorse with the Urban Counties Caucus. I'll be brief. I would associate my remarks with Pat Ryan of CMHGA and CSAC's comments. We do believe we're already in transition in the county world. We've been long underfunded in this program, and this proposal provides secure and adequate funding for schools and would also help counties to continue to provide services if needed and if the schools want to contract with the mental health professionals. So we are in strong support of the governor's proposal. Thank you.
Thank you.
Good morning. I'm Rusty Gordon, Yuba County SELPA, and also on behalf of the state SELPA organization, I just want to reiterate what Shelton Yip stated, that we do believe that this is a viable option. We know that shifting responsibility will take time, and implementation will come at varying levels, as we have certain SELPAs that are able and have the capacity to take this on right away, and others will need some more time. So we do support the necessary changes and some flexibility for the SELPAs to be able to accommodate these changes as they occur, because we do have some that have the capacity right now to take on this challenge. So, and we are committed to all the educational needs of all the special ed students in the state. Thank you.
Thank you.
Morning, Madam Chair and members. My name is Randy James. I'm actually a parent of a emotionally disturbed child. My son hit rock bottom at the district and was put in a program, though it took us about 2 years discussing with the district on getting him into the program. The program now has sufficient mental health support. Problem with the current direction doesn't help some of the students, because in our area in Placer County, they're actually not planning to have as many mental health service people supporting the schools. Currently, there are 4 LCSWs and 5 highly trained aides in my son's school. With the next school year, after they end this year, the county is planning, County Office of Education is planning to actually pick up 1 LCSW and 3 or 4 less trained aides within each of the classrooms. There are 2 classrooms, so about 6 aides. We feel like we were kind of blindsided by this earlier this year, and have created a family support group to kind of look at some of the things that we can do. My problem with the changes are that there isn't sufficient planning, and that the staff are not going to be at a good staffing level for some of the supporting some of the services. Transition, like I said, currently is they're going to end this year with the current staff, and next year is going to be an entirely different staff. The problem with some of these students right now is that they don't transition well. So yes, they're going to have about a month off during the summer because if they have an extended program during the summer. They come back to an entirely different staff, and it's really going to be a problem with them. So
thank you.
Thank you for your time.
Good afternoon. My name is Jessica Cruz. I'm the Executive Director for the National Alliance on Mental Illness for California. And at this point, we cannot support what the governor has proposed, basically because there is no transition plans in place. So we would like to see a transition plan in place, and also we would like to see more stakeholder involvement, maybe sitting on the work group that the Department of Education recommended. We would like the families, the parents of those children who are receiving the services to have a voice in this process. Thank you.
Thank you.
Good afternoon. Dr. Camille Giametti-May. I'm the Assistant Superintendent for Yolo County SELPA, and I'm here representing the Coalition for Adequate Funding. The Coalition would certainly like to support our comments made by our colleague Shelton Yip. And just really briefly, the Coalition regarding encouraging a dedicated, equitable, and stable funding stream for those services needed by students with emotional disturbances now and in the future. Encouraging fiscal flexibility for schools to provide these services, a cap on administrative fees levied by county mental health for those school districts who choose to contract with county mental health, and lastly, granting to school agencies the ability to seek support funding such as Medi-Cal. Thank you for your dedication.
Thank you.
Hello, I'm Stuart Teal. I'm a child psychiatrist. I was in charge of children's mental health services for Sacramento County from 1973 to 1977. And so I know how it worked before 3632. I also represent 600 child psychiatrists for the California Academy of Child Psychiatry in the state of California. It didn't work. I had parents coming up to me and saying, I can't take my child out of the hospital because I can't take him home. He's going to murder his brothers or his sisters, and that has happened. There was no way to get funding for that child other than to discharge the child from the hospital and have the parent take the child to the children's receiving home, drop him off or her at the children's receiving home, and be threatened by social services that they would be put in jail for abandoning their children. This is what was happening prior to 3632, and it happened over and over and over again. It's not a single case. I don't like this proposal. I don't believe the school districts can do this. They're not staffed. They're not educationally prepared. They don't have, mental health professionals working for them. I don't know why people think that they can just do this. And the most telling thing was that the people who did get service prior to prior to 3632 were the people who had money. The poor kids, the minority kids, they were left on the streets. The school districts did not contract with mental health. They avoided doing IEPs over and over and over again. So I don't know why the governor, the legislature, wants to go back to the bad old days. In this current system, you have social services, mental health, families, and education sitting down at the IEP table and planning a program. The only problem has been that the legislature and the Department of Finance have not funded the program. They haven't paid for the services. Well, why the heck don't they just pay for the services and forget about all of this?
Thank you.
Good afternoon. My name is Eileen Kubansky. I'm with the County Welfare Directors Association, testifying in support of the Governor's May revision proposal. From a county social services perspective, basically under AB 3632, we're just a pass-through for the funds for the residential placement costs. We're billed by the residential placement providers. We make the payment. And I'd note that some of those payments are pretty expensive. We do this with a combination of state and county funds. But we're not involved in the placement decisions for these kids. They're not foster youth. They're not in the foster care system. So we don't provide to them the typical kinds of case management and other services that we would otherwise provide to youth who are in that system. So we think that the governor's proposal from that perspective makes a lot of sense. I just wanted to correct what I hope wasn't a misimpression left with the committee as a result of some of the panel testimony. Counties will have general fund or county fund savings from this in realignment due to the shift, but I didn't want you to leave you with the impression that we're somehow getting a windfall from this proposal. There are corresponding reductions in the May revision to the child welfare services base under the governor's realignment proposal that we've been informed we're expected to cover with the savings that we're going to get on the AB 3632 side. It basically nets out for us, so we're not left with some funding windfall. So I just didn't want to leave you with the impression that that was the basis for our support, but more for the reasons I articulated as well as those expressed by CSAC and CMHDA were in support of the proposal. Thank you.
Thank you.
Hi, my name is Ariana Casanova. I'm with SEIU 10-1. I'm the political organizer for the East Bay. I wanted to talk a little bit about my concerns with it going to the schools. In Alameda County, right now it's in the county, and since the mandate, we have MOUs with the school district. It wasn't the school district that went into MOUs with the county. We provide service to 1,100 outpatient services, which it's about $27 million. Half of that $27 million does go to Medi-Cal, Healthy Families. I wanted to really pose the question, is this enough funding for the school district? And a lot of the school districts, I worked for a school district at the local level. I've worked in various arenas in the local level, and I just don't see the burden of mental health. In the classroom, a teacher is burdened with the behavior of a student. We all know the state of education. Shifting another service or another responsibility to the school districts, to the teachers, and to that community that's already in a lot of pain and not getting the proper services for just education and adding the burden of mental health and behavior issues is something we really need to consider. We need to see what could be a hybrid between the school district and the county. And some of that is happening as a consequence with the suspension, but I do really encourage that we really look at some of the hard questions, and I don't think now shifting from the county to the school district really resolves a lot of the issues and concerns of the parents, the children, and the school environment. Thank you.
Thank you.
Good afternoon, Madam Chair and members. My name is Simeon Gamp, Service Employees International Union, and we oppose the governor's shift to the schools. We provide the services through the counties, and we feel that if in fact this does happen, we would encourage continued contracting out with the schools, as well as if in fact there's a work group, we'd like to see SEIU at the table as stakeholders. Thank you.
Thank you.
Morning, my name is Kevin Aslan. I'm with the Coalition for California Welfare Rights Organizations. This sounds like a policy committee hearing. It's a policy issue that should have gone through the regular process. We used to do bills in California. Now we do budget hearings, and then next thing you know, something comes out of the blue sky, and boom, it becomes a bill. And we're grateful that we have actually a chance to look at the language. And I think that the previous speaker was right that the Department of Education people should do teaching. Mental health people should be dealing with the mental health problems, just like in the welfare system. They have the employment programs run by the welfare department. It should be run by EDD, and they're mixing it up over here. Thank you. We oppose this proposal.
Thank you. All right, thank you very much. We appreciate the public comment. We appreciate both our panels for speaking on this issue. The recommendation is that we hold this item open. We will be having another joint hearing tomorrow around the issue of child care. So we'll see you all again there. We have an earlier hearing. I can't remember. I don't have the agenda in front of me. What the other hearing is tomorrow. Higher education. So the hearings continue around the budget. Thank you for your input. And with that, we adjourn the meeting.